having intense glute pain, and it may even be shooting down your leg. So what is going on? So that can be piriformis syndrome, that can be a lumbar disc problem, can be facet syndrome, can be sacroiliac. There's lots of different things that could be, but what we're talking about today is piriformis syndrome. So the piriformis runs from the front side of the sacrum right here, which is like a triangle at the base of the spine, and runs diagonally down to the greater trochanter right there. So it basically runs just like that, and in some people the sciatic nerve goes straight through. Most of the people it goes like this. Sometimes it goes above, sometimes it splits. There's all sorts of different morphologies that we see, but essentially if you're having symptoms, it's likely that yours goes right through, and any pressure or excessive exercise of that piriformis, like deep squats, lunges, running up hills and things like that, sometimes cycling, will cause tension in that piriformis and really pinch on that sciatic nerve and cause symptoms down the leg. To fully assess your low back or posterior hip problem, we will take you through a bunch of assessments. So first we would take you through a global assessment, just full flexion and extension, just to see what do you feel when you do both of those, and that points us in a direction of where to test you next. So we will use neurological testing, so rule out any nerve compression to make sure you're not having neural deficits. Those are pretty serious. And then also do muscle testing to find out what muscles are really strong, what muscles are weak, and that directs us where to create your rehab program. Lastly, we will use McKinsey method, trying to figure out what movements make you feel better and which ones make you feel worse, so we can tell you what to do and what not to do, so that you can help yourself get better as fast as possible. Once we've taken you through a full assessment and evaluation, we have a really good idea of what's happening, got a solid diagnosis, then we can create a treatment plan customized to you. So we will initially focus on what we can do in the office. So in the office, we will do soft tissue work, so active release technique, fascial distortion model, deep tissue massage, adjusting, so chiropractic manipulation, and we will give you what we call activity modification, which is really exercise or the changing the way you move so that you're not making yourself worse. So those are the types of things we would do in office. We would also advise you on exercise, so strengthen what's weak, loosen what's tight, so that you can have a home exercise program in addition to the McKinsey method self-treatment exercises that we taught you. And all of those will help to loosen up your piriformis, decrease the amount of stress you're having on your back and your hip. Some of the common things for piriformis would be, for instance, sitting on or preventing sitting on it as much as possible, or putting a nice cushion so that you're not putting as much pressure on that. So just that sensitivity of the nerve is pretty intense usually in especially acute piriformis syndrome. So those are the types of things we would do for your treatment, and all focusing on getting you out of pain as fast as possible and using a combination of different modalities like massage therapy, chiropractic, as well as physical therapy type exercises to get you feeling better as soon as possible. If you'd like help feeling better, give us a call. We'd love to help.